Namaste. Now I am going to speak about role of counselor in palliative care. This presentation is from Department of Pain and Palliative Medicine, Gujarat Cancer and Research Institute, Ahmedabad. The role of counselor is very huge, very unique and very important. As we have discussed earlier that palliative care is not only physical care, but you have to address the psychosocial and spiritual aspect of the patient and caregiver. Hence, the role of psychologist, counselor or any team member acts as a counselor in palliative care setup. So, as a counselor you have to address the concerns of patients and relatives, general principles of counseling, about the disease, about the holistic care, diagnosis and prognosis, general care and hygiene of the patient, psychology of the patient, spiritual pain in patient and caregiver and psychosocial issues, bereavement counseling, spiritual pain and financial aspect and ongoing research in the counseling process. Concern of the patient and relatives are many. First of all, when the diagnosis of the cancer is established, the first question comes whether it is curable or not. Why I am being avoided? Am I infective? Will my sex life be affected? What will people will say? Will children get this from me? I am not getting the needed support from the family. Sometimes patient feels neglected. I am scared to go out. Why do people treat me like an untouchable? And why me? Why I got this disease? Why me? That is a spiritual pain. So, these are the many questions which haunts the patient. And here comes the role of counselor. He has to explain the disease, its status, stage of the disease. He has to take care of the holistic part like psychosocial, financial and spiritual aspect of patient. He has to understand the psychology of the patient, psychosocial aspect of the patient, financial, spiritual aspect of the patient. General principle of counseling includes getting to know the patient and their background. First of all, you try to find out from where the patient has come from, what is his education, what is his occupation, what is the social background, who is supporting him, who is a caretaker of the patient and many more questions, related questions. Communication like tumors may be benign or malignant. Before using this terminology, one has to be very cautious, very precautious, and aim of communications are to reduce uncertainty in the patient, enhance relationship and give a patient and family a correct diagnosis, correct direction to move on. So, these are the general principle of counseling. Regarding disease and status, counselor should know the nature of the disease, the stage of the disease and what are the treatment options like it is surgery, chemotherapy or radiation therapy and whether the disease is treated with the intention of palliation only or curative intent. And with all these issues are tackled with holistic approach. Second role is in breaking bad news. Many a time counselor has to do this duty of breaking bad news So, he has to find out how much patient knows, what he knows, and he has to share the information after getting patient's family consent. Then he has to respond to the question from patient and family, and he has to give them planning about the follow up. Breaking bad news is done right at the diagnosis. It is required when the disease has recurrence, when the disease is progressing, metastasized and in advanced stage, and in terminal patients. Patient is also counselled about their medicine, how it is to be taken, why it is given, and what are the side effects. Sometimes counsellor has do this role also. General hygiene, he needs to counsel, he can get into counseling about the nutrition aspect, what to eat, why, how to eat. Most of our patients are with nasogastric tube feeding and they need to take only liquid diet. So, how to prepare these liquids? Usually it is the role of dietitian or nutritionist, but in many center when unavailability of dietitian, counselor or nurse performs this duty, and about the general hygiene of the patient as well. General hygiene usually looked after by nurse, but counselor, if patient or relative comes up with the question, counselor has to address it. Wound care, apart from dressing of the wound, patient has many questions about the wound, as the many of the wound affects the appearance of the patient, particularly in head and neck patients. So, any questions regarding this, counselor will have to address regarding appearance of the wound, loss of functionality, and any question related to sexual impact on the patient's life. Counselor has to understand the psychology of the patient. We have already described various psychological aspects of patient, and counselor has to address them at most of the time, like patient is in fear, he is anxious, there is a patient is in denial, whether he is in depression, patient has got feeling of guilt and shame, patient is angry with God or with family member, patient feels neglected and patient feels isolated. So, all these psychological aspect he has to evaluate, address and counsel it with proper communication with the patient and family. Common symptoms which we found in palliative care is described here, like vomiting, nausea, dysphagia, shortness of breath, anxiety, constipation, lack of appetite, depression, insomnia, weight loss. So, patient has, though these symptoms are treated by physician or a doctor attending him and or by nurse attending him, but related to these symptoms patient has many questions which needs to be addressed by counselor. Coming to psychosocial aspect, the commonly found problem in patient, particularly patient of cancer, are described over here. First is touchability. Almost nearly 80 to 90% of the patient and caregiver comes with this question whether this cancer can spread by touching the patient. So, many a times relatives do not allow small children to go towards the near the patient. Patient feels isolated and neglected. Second most common problem is appearance, particularly head and neck cancer patient, and even patients of other cancer when they are receiving chemotherapy or radiotherapy, their look is changed, there are skin changes, hair loss, and in head and neck cancer patient there are big tumors on the face, around the neck, and the appearance is affected. So, here the patient has got self withdrawal from the society, he does not go in gathering, he does not meet the people, he tries to avoid getting in contact with other friends or family. So, that appearance is also one of the biggest problem. Confidentiality, many patients wants to hide the diagnosis of cancer, and this needs to be addressed, because when the patients are on home care, many a time our home care one goes to the patient's house, and many of the patient tells us that keep your one as away as possible, our neighbors does not know that we are suffering from cancer. So, loss of control socially, now socially he does not have any say, he has loss of role, he is no more involved in the decision making or in social gathering. Issue of privacy, social stigma, still cancer is a social stigma. So, people want to hide that diagnosis from others, and because of this there is a restraint from social activities. Impact on social sexual function is also very large, and difficulty in accepting that I am suffering from cancer, that is a difficult to accept. So, patient goes into denial, even family members do not accept this, and sometimes they neglect the patient. Hair loss, as I said, following chemotherapy or radiotherapy, fear of death, cancer is linked with death. So, once you get cancer, the first question is it curable or will I survive, and then comes the bereavement. After loss of patient, the family members are in shock, that and at the same time they are having fear, anxiety about their future, about their children's future, whether they will also get cancer or not. So, psychosocial impact is tremendous in patients who are on receiving palliative care or who are suffering from life limiting illnesses like cancer, HIV, AIDS and many others. The fear of death not only for patient, but the near ones also, and hair loss, particularly in cancer patients of cancer breast, these females has lots of anxiety about the hair loss, and it is difficult to sometimes difficult to convince them, and many a times they refuse chemotherapy because of this fear of hair loss. Bereavement counseling also very important role a counselor has to play by helping the relative identify and express their feelings. So, after death of patient, counselor goes and meets the family, and they try to find out by expression of their feeling, assist them to live without the disease. So, now there is a loss of member in the family, and counselor helps them in coping up with this situation, and provide them time to grieve and constant support, facilitate emotional withdrawal from the disease, and examining individual differences and coping style. So, many a time counselor helps them in getting back them to the work, getting them back to their hobbies and meeting people around. So, counselor has got a role in bereavement counseling as well. Spiritual pain, this is the most difficult pain in patient who are suffering with life limiting illness. It is difficult to identify this pain, it is difficult to assess this pain, and at the same time difficult to treat this pain. So, spiritual pain requires special consideration, special training, special communication for the caregiver also and for the counselor also. Cancer is linked with death and your karma. So, most of the time people feel what wrong I have done in life. So, God is punishing me. Why me? I have not done anything wrong in life. Then why I am suffering from such a drastic disease? From here where I will go? Why I am suffering? Why does God allow me to suffer like this? What is my relationship with the God? How can I believe in life after death? And can I be forgiven even if I have done something wrong in life? Can God forgive me and take away this disease and cure me? What is the value of my life? See, I am just 45 and I got this cancer. I will die within few months. Then what is the value of my life? Why has this happened to me only? And like why me? So, these are the questions which are related to spiritual pain, and counselor has to address them. Uh, Patient is allowed to express their feeling, and counselor trying to find out the coping mechanism and explain to the patient. Cancer is the disease of underprivileged and for the patients who are from the poor resource setting in India. So, particular because of their surrounding, because of their nutritional status and because of their habits. Most of the people from labor class and all, they have habits of tobacco chewing and alcohol consumption, which can lead to cancer. But various government schemes are available, and in our department, counselor used to handle this part of informing the patient and caregiver about the various schemes available to support the cancer patient. Now, under Ayushman Bharat, all cancer patients from any states are covered and they are given free treatment. Many NGOs are also working for cancer patients and support them, their treatment and their therapy. So, here if counselor is having has to keep all this information and pass it on to the patient and help them getting these benefits of from various government scheme and NGO supports. In every palliative care history form, there is a page for psychological assessment of the patient, and here there are many questions related to patient's background, social background, educational background, what profession he is from, what are the habits he has, his previous history and many other information is there. So, Department of Pain and Palliative Medicine has a counselor who is working with the patient and caregiver, not only for the psychosocial evaluation, but also to inform patient about various government scheme, various support he can get from the institute as well as from the NGOs, and they also help the nursing staff in giving proper guidance about the nutrition and hygiene of the patient. Thank you very much.